Rotator cuff pain can be one of the most frustrating pains. They take a long time to get better, and if they aren't treated properly, it hurts to sleep on your side, it can ruin your workout, it hurts to fasten or unfasten your bra. I mean, at least that's what I hear, even though it's 2025. I still haven't personally gotten into wearing bras, at least not yet anyway. But in this video, I want to take you through 3 secrets on how to speed up the process of getting a pain-free, functional rotator cuff. So let's start out by just defining the whole situation, right? What is the rotator cuff? Unfortunately, a lot of people think it's called the rotator cup, like there's some cup rotating around on your shoulder. Other people think the rotator cuff is a singular physical structure. This may be disappointing, but the term rotator cuff is simply referring to a group of muscles in the shoulder. Similar to the thigh, where we have the vastus intermedius, the vastus lateralis, the vastus medialis, and the rectus femoris, we group them together and we call them the quadriceps. In the shoulder, we have the infraspinatus, teres minor, supraspinatus, and subscapularis, and we group them together and call it the rotator cuff. So what that means then is that the rotator cuff and rotator cuff pain is simply pain from a tendon or a muscle or a combination of them in the shoulder. So let's get to the 3 secrets to speeding up the process of getting a pain-free, functional rotator cuff. Secret number 1 is not to jump into anything radical too soon. Give rehabilitation a fighting chance. When a physical therapist or a chiropractor gives you exercises, be consistent with them. It's a process that doesn't happen overnight. You have to be patient. Don't freak out if some MRI shows a tear in the rotator cuff. Abnormalities in the rotator cuff tendons are not abnormal, even in people without pain. For example, this 2019 paper took people with shoulder pain on one side. They did an MRI, but at the same time, they took an MRI of the non-painful shoulder. They found that 93% of the painful shoulders had a rotator cuff abnormality, but when they took an MRI of the same person's non-painful shoulder, they found 89% of the non-painful shoulders also had rotator cuff abnormalities. So this means that if you have pain in your right shoulder, let's say, and you get an MRI and it shows you have a partial tear in a rotator cuff tendon, you probably have the same thing in the left shoulder. So if you're curious, you would then ask, why does one shoulder hurt and not the other? Well, the real cause is almost always a load versus capacity problem. You asked your shoulder to do more than it was ready for. For example, maybe you started doing a more intense workout than your shoulder wasn't used to. Maybe you started sleeping on that side more. Maybe you're a weekend warrior and you played 3 hours of pickleball when you hadn't played for months. Those are all examples of a load being applied that's being greater than the capacity of the tissue. On the other hand, maybe your capacity is low because of other factors like stress, systemic inflammation, not sleeping well. We know that those scenarios increase inflammation in the body. But in the end, it's simply an issue of inflammation and poor healing due to an imbalance of the load versus capacity. And if we want to take the whole imaging thing a step further, let's say you get an MRI when you're in pain, and then you go through a rehab process and you feel 100% better, and you take an MRI again. The MRI, when you feel 100% better, is going to look the same as it did when you were in pain. This study and many others clearly show this, and they conclude both in tendon repair following a tear and in tendinopathy, recovery of pain and restoration of function does not go hand in hand with the appearance of the affected tendon at imaging. The tendon may remain altered for a long while, possibly forever, indicating a possible dissociation between morphology and symptoms. Morphology meaning what it looks like on the MRI. This paper says the same thing. Improvement of shoulder symptoms is not directly associated with MRI findings. Now, the exception to this rule would be a traumatic origin, right? If you fall on an outstretched hand or you fall directly on your shoulder, you may have significant pain or weakness, and in that case, the imaging does matter. But without trauma, imaging may just be setting you up for needless worry or even unnecessary surgery. And speaking of surgery, there have been many studies questioning the effectiveness of rotator cuff surgery. They've got ethics panels now approving these studies where you take people with rotator cuff pain or rotator cuff tears, and half the people get real surgery and half the people get fake surgery. They're just told that they had the surgery. And in the end, there's no difference. That led to the prestigious Cochrane collaboration to publish a paper where they took the data from 9 different studies totaling more than 1,000 patients, and they concluded, at the moment, we are uncertain whether rotator cuff repair surgery provides clinically meaningful benefits to people with symptomatic tears. It may provide little or no clinically important benefits with respect to pain, function, overall quality of life, or participant-related global assessment of treatment success when compared to non-operative treatment. So lastly, as I said earlier, be consistent with the rehab exercises. This paper looked at real versus sham surgery versus physiotherapy, and they concluded, we recommend that healthcare professionals who treat tendinopathy encourage patients to comply with loading exercise treatment for at least 12 months before the option of surgery is seriously entertained. 12 months, so 1 year of rehab before you even entertain the idea of surgery. Okay, so I hope my point gets across on this. Be consistent with rehab and don't rush into needless injections or surgery, and don't be overly concerned about what you see on imaging, unless your pain is due to trauma. All right, so now let's move on to the second secret to getting rotator cuff tears pain-free and fully functional. Grip strength. Yeah, I know, it sounds a bit strange, but stick with me for a minute on this one. The primary focus of improving shoulder function should be through shoulder-specific strengthening. However, grip strengthening also plays an important role. This is because gripping enhances rotator cuff activation. When you grip something, the rotator cuff starts firing. EMG studies reveal that engaging the hand increases rotator cuff activation during various shoulder abduction angles, thus augmenting the stabilization of the joint. For example, this randomized trial tested whether adding hand grip strengthening to conventional therapy improves recovery from rotator cuff pain. Patients who did the extra grip strengthening had greater reductions in pain, bigger improvements in shoulder function, and stronger rotator cuff muscles than those doing the standard rehab alone. Range of motion in flexion and abduction also improved in the grip group. This is an example of one study, right? But if we want to look at the totality of all the studies, we can look at this 2025 meta-analysis that found while several exercise types can decrease shoulder pain in the short term, after 2 months, only hand grip strengthening continued to deliver statistically significant pain relief. Exercises like shoulder mobilization, stretching, scapular stabilization, and eccentric work no longer reduce pain at that stage. Interestingly enough, when it comes to functional outcomes, the other type of exercises did remain effective by the 2-month mark. So to improve function and reduce pain at the same time, shoulder strengthening and hand grip strengthening are both important. You can easily work on hand grip and shoulder strengthening exercises into the same exercise. Some examples might include bottoms-up kettlebell screwdrivers, bottoms-up kettlebell arm bars, bottoms-up kettlebell press. You need a lot of grip strength to do those shoulder exercises. So doing some hand strengthening should help you get a grip on shoulder pain. Okay, so the last secret on lessening shoulder pain and improving function is getting better mobility in the thoracic spine, your mid-back, right? Every time you move your arm overhead, the thoracic spine needs to be mobile. If you're lacking mobility in the mid-back, right, you may be putting more stress on your shoulder. Multiple studies have shown at least an association between altered mobility or posture in the thoracic spine to increase risk of shoulder pain. Now, to be fair, the association doesn't always mean causation, right? We've said that in many videos. However, in this case, multiple studies also show that increasing mobility of the thoracic spine can also reduce shoulder pain, including this new 2025 meta-analysis of 10 randomized controlled trials. They found that thoracic spine manual therapy, or TSMT, produced large clinically meaningful reductions in shoulder pain, both in short term and intermediate term. It also led to significant improvements in shoulder disability scores and enhanced internal and external range of motion of the shoulder. So yes, treating the thoracic spine through mobility drills or foam rolling or manual therapy, it can help improve shoulder pain and function, right? So there you have it. Rehab first, right? Not surgery or injections. Don't jump into something radical right away. Be consistent and patient with your exercises. Number 2, grip strengthening, because when you grip, it helps strengthen the rotator cuff. Number 3, mobilize the thoracic spine, because a stiff mid-back can overload the shoulder. And studies show improving mobility on the thoracic spine generally improves shoulder pain and function. So rotator cuff pain doesn't have to drag on for months or years. With the right strategy, you can restore function, reduce pain, and get back to the things that you love.